The arteries are very important vessels in the body. The arteries are a critical part of your cardiovascular system. They are blood vessels that distribute oxygen-rich blood to the entire body. Imagine what will happen if the arteries explode. In today's video, we will go through how to stop an exploding artery and prevent blood clots. So stick by as we run through the important tips that you need. Before we get into details, make sure to like this video, subscribe to this channel, and turn on notifications to get updates on new videos. It is important to know why an artery may burst before looking into its treatment. Why do arteries burst? Before arteries burst, they first become enlarged. This is called aneurysm. An aneurysm is the enlargement of an artery caused by weakness in the arterial wall. Aneurysm doesn't always show symptoms, but a ruptured aneurysm can lead to fatal complications. When an aneurysm happens, the artery walls become weak and a bulge or distension is created. Aneurysm mostly affects the arteries supplying the brain and the heart, and this rupture can cause internal bleeding. Blood clotting can also happen because of the leaking of blood. This is a dangerous situation that can result in the death of a patient. Types of aneurysm. Since there are a few types of aneurysms, looking into some of them will help us understand the treatment to give. Number 1. Aortic aneurysm. The aorta is the large artery that begins at the left ventricle of the heart and passes through the chest and abdominal cavities. Aorta's diameter is between 2 and 3 centimeters, but can bulge beyond 5 centimeters if it has an aneurysm. An aortic aneurysm is a balloon-like bulge in the aorta, and the force of blood pumping can split the layers of the artery wall and let blood leak in between them. Number 2. Cerebral aneurysm. A cerebral aneurysm, also known as a brain aneurysm or intracranial aneurysm, is a weakness in a blood vessel in the brain that balloons and fills with blood. Brain aneurysms often occur between the underside of the brain and the base of the skull. The aneurysm can leak or rupture, causing life-threatening bleeding. A ruptured aneurysm of the brain can be fatal within 24 hours. Number 3. Peripheral aneurysm. Peripheral aneurysms is a weak area of a blood vessel that expands or bulges, affecting the other arteries and not the aorta. Most peripheral aneurysms occur in the artery that runs down the back of the lower thigh and knee. This artery is called the popliteal artery. It is the most common peripheral aneurysm. It can also allow blood clotting. Number 4. Splenic artery aneurysm. This type of aneurysm occurs near the spleen. Treatment. All unruptured aneurysm cases may not need active treatment, but when it does, there's an emergency need for surgery. The doctor will need to monitor unruptured aneurysm cases for symptoms. If symptoms appear, active treatment will be needed. A ruptured aneurysm needs emergency surgery. Without immediate repair, patients may lose their lives. Patients are advised to let the doctor know if they feel any strange activities in their bodies. I hope this video has helped you figure out how to stop an exploding artery. If you have a suggestion or any other concerns about some of the treatments and methods to stop exploding arteries listed in this video, please tell us in the comment section.